Hey everyone, my name is Dr. Rob Johnson. I'm a dentist in Salmon Arm in BC in Canada, but I'm much better known as Rojo, so I might introduce myself as Rojo next time. So what this video is about is I was on a phone call last night, or a Zoom call, with a group of dentists that are trying to be organized and fight back against Bonnie Henry's new mandates that affect all of the private sector healthcare workers in the province of BC. And Bonnie Henry had made some ridiculous announcement a couple weeks ago that the COVID vaccines will be mandatory as a condition of licensure somehow or something. I don't know how they plan on enforcing any of this garbage. But they're going to be mandatory for all of the private sector healthcare workers, which is a massive list. Acupuncturists, Chinese medicine practitioners, physiotherapists, chiropractors, dentists, dental hygienists, dental assistants. And I mean, the impact of that is beyond anything you could ever even imagine. So I think I need to start right off the bat by addressing these ideas of, anyone who is opposed to Bonnie Henry's ridiculous mandates is a conspiracy theorist, anti-vaxxer, anti-masker. Because those are labels that have been invented to just be able to discredit and dismiss anybody that is trying to say, hey, this doesn't make any sense. And it's not helpful at all. So I'm not going to get into my personal opinion on vaccines in general or the COVID vaccine or masks, because none of that even matters. The point is, I have been saying for the past 2 years, I've been saying two things. You need to have some sense at some point. Stop doing things that clearly make no sense. There's no science, there's no logic, there's no basis for most of this garbage, so stop doing it. The second thing I've been saying is figure out which line you're not prepared to cross. Because apparently, according to people smarter than me, when you've been conditioned by the absolute nonstop fear porn, fear-mongering propaganda of our government-controlled media, to believe that everything that you're being asked to do is for the greater good, then there is no line that you won't cross. And so you better figure out if there is before it's too late. But here's how I look at this situation. Getting this vaccine or any other medical procedure, it requires the informed consent of the patient. And that consent has to be freely given. They have to have the information they need to make a decision and then make it themselves. You cannot be coerced or incentivized or defrauded into this. And so when Bonnie Henry announced this mandate for healthcare workers, I'm thinking to myself, okay, well, if these people are going to be healthcare workers, their primary value needs to be patient autonomy and informed consent. So I don't care what you think as far as how bad is COVID really and how safe and effective are the vaccines. That's irrelevant to the conversation of whether they can be mandatory. So that needs to be 100% hard no. So if she's going to announce such a ridiculous thing and there isn't a revolt by every single healthcare provider in the hospital, then you can't go to the hospital anymore because it's unsafe, because those people don't care about patient autonomy. So I don't see very many hills after that. This is the hill you need to die on. And the other issue is, so I saw this exchange on social media a while ago, which said, the first person said, don't assume malice, assume ignorance, because life is better, you can be kinder, and you can educate people, and true malice is rare, I find. Very beautiful sentiment. Somebody responded underneath and said, don't forget Hanlon's razor. Don't assume malice when incompetence will suffice as an explanation. That said, however, also keep in mind Fred Clark's law, which is sufficiently advanced incompetence is indistinguishable from malice. There's a point at which ignorance becomes malice, where it's simply not possible to be that ignorant except intentionally and maliciously. So when I look at Bonnie Henry's mandates, as far as I'm concerned, there is no scientific, logical, legal, ethical, or moral basis for any of them. So in my mind, that only leaves evil and incompetence. And I don't honestly know which would be worse. But like I just said, it's indistinguishable at this point anyways. So why are we still doing this? I do not understand it. And I don't even understand how technically she's going to mandate it for the rest of us in the private sector, because it's somehow going to be done through our colleges, our licensing bodies, our regulatory bodies. And so that to me highlights a very significant problem, which is that this whole concept of licensing and regulation needs to be rethought, because the way it exists currently, there is actually no benefit to the public in terms of protecting the public. These are useless bureaucracies that can be weaponized by bad actors to tyrannize and oppress anyone who challenges the status quo. And they are pathological and corrupt institutions, and I am personally about finished with legitimizing them by participating in them. So that's the bright side as far as I'm concerned, is the more they pull this garbage, the harder it is for people to try to rationalize and justify it, and for their cognitive dissonance to allow them to keep believing that this makes any sense on any level at all whatsoever. So quite a few other provinces, most other countries, are dropping this nonsense. So what I would like to know is, what planet is Bonnie Henry on? Because here on Earth, we're not playing this game anymore. And I also would like to know why there is not one person at the College of Dental Surgeons of BC or any of these other colleges and regulatory bodies that has the common sense, critical thinking skills, or integrity to tell Bonnie Henry to crawl back into whatever hole she came out of and not come back out again, please and thank you. So anyways, I don't even know how to end this, but basically my point is, and as I'm sure I'm preaching to the choir here, this is so ridiculous on so many levels that I cannot take it anymore. And I would really appreciate if you would share this video. And because we need a grassroots movement. We need people to say, we're not playing this game anymore. And we've only got 24 days. Or I don't even know. I don't even know how this even works. But supposedly as of March 24th. Oh, and by the way, please explain how you can justify this. So I'm a dentist, and I do a pretty decent amount of work, dentures and oral surgery and dental implants, that a lot of other dentists don't do. A huge part of my practice is people coming off the street to see me for things that I'm one of the only people that actually does them. So where are those people supposed to go for treatment now when I'm not allowed to do this anymore? And it's the hilarious thing. I was on a call with the BC Dental Association several weeks ago, and somebody asked the question. They said, whatever happened to continuity of care? Like we have some obligation to our patients to make sure that they're able to receive care if they need it. So if we have some kind of a breakdown in a relationship with a patient, we don't want to treat this person anymore, we still have to treat their emergencies and make sure that they're taken care of until some reasonable time when they can find themselves a new dentist to go and see. So someone said, like, what's, a bunch of us aren't going to be allowed to work. So what's going to happen? And they said, well, if you're choosing not to get the vaccine for whatever reason, you may have a legitimate reason or not, if that's a choice you're going to make, then you need to have a plan. You need to hire a locum or an associate to cover your practice and take care of your patients. And I was like, I can't. You can't. You're not serious. You have to be joking. Like, this is actually a hilarious joke at this point. So anyways, like I said, the impact of this, as far as dentists having to close their entire practices and all of their staff being laid off, or dentists where a bunch of their staff are unvaccinated and they're not going to be able to have staff anymore and they're not going to be able to treat patients. None of these people are going to be able to provide for their families. It's just beyond the beyond. So I don't even know. I'm making this video in the hopes that it's going to inspire more people to go camp out in Victoria. I don't even know. I don't even know what we need to do. That's what's so frustrating, is it doesn't even seem to be a functioning mechanism or system of checks and balances where anybody can say, hey, we're not actually going to do that, because that makes absolutely no sense. There's going to be zero benefit. There's going to be massive harm. So no, sorry, thank you. We're gonna go a different way. So anyways, I'm rambling now. I gotta wrap this up. Thanks for watching. Please share it. Please make your own videos. Please email people. Please do whatever the hell you think you can do to try to get some sanity back in our lives before the 24th of March. Thank you very much. Bye.